Hi friends, thank you for tuning in to the Concussion Coach podcast. I'm Bethany Lewis, the Concussion Coach. I'm a neurological occupational therapist and certified life coach, and I specialize in guiding people through their concussion recovery journey. I am passionate about helping people understand their injury, speed up their recovery, and reclaim control over their life post-concussion. The purpose of this podcast is to help increase awareness of concussions and the impact they can have on a person's life, and to bring hope to people who have suffered a concussion and those who love them. I firmly believe that sharing stories and knowledge about concussions will bring important light and understanding to this misunderstood and often invisible injury. The information in this podcast is meant to bring that awareness and hope and is not meant as medical advice. The opinions shared are those of the interviewees and my own. If you are suffering with lingering concussion symptoms, I have created a concussion coaching program specifically for you. I will be your mentor to guide you through your recovery journey, offering help with understanding and managing your symptoms, setting achievable goals, and learning how to manage your own thoughts and nervous system in order to get control over your life again. If this program sounds like something that would help you or someone you love, sign up for a free consultation. In the consultation, you'll get valuable information and resources and gain hope for your future. Sign up for your free consultation at the link in the show notes or at my website, www.theconcussioncoach.com. Hi friends, welcome back to the Concussion Coach podcast. Before I introduce my guest today, I just wanted to make sure that you all know about the free guide that is available on my website. It's the 5 best ways to support your loved one dealing with a concussion. If you have a friend or a family member who is struggling with post-concussion symptoms, or if you're the one struggling and would like your loved ones to know more about what you're going through and how they can help, head over to my website, www.theconcussioncoach.com, and download the free guide. I'm really excited for this interview. My guest is a fellow occupational therapist, and I love connecting with other OTs who are passionate about helping people in this space. Kathryn Tuazon is a New Jersey-based occupational therapist with over 7.5 years of experience, specializing in neurological conditions, including concussion, stroke, spinal cord injury, and Parkinson's disease. She received her master's in occupational therapy from Thomas Jefferson University and currently works in an outpatient hospital setting. Kathryn is a certified stroke recovery specialist and is an LSVT BIG Certified Clinician. She recently completed LoveYourBrain's 20-hour training for health professionals and is in the process of becoming a functional vision rehabilitation specialist. CFVRS. So many letters. Kathryn is dedicated to client-centered and holistic treatment, believing that her patients should be empowered as collaborators in their own recovery. A lifelong learner, she's also passionate about education and mentorship in the clinical setting, collaborating with and mentoring both PTs and OTs to promote a high standard of interdisciplinary care, which is fantastic. We need that. I'm so excited to get to meet you and talk to you some more, Kathryn. Thank you for being here.
Thank you for having me. I'm so excited.
Yay. Okay, so before we jump in, what is LSVT BIG certified?
Oh, so LSVT BIG, it's a program for specifically Parkinson's disease. So you'll have LSVT loud for vocal production for the vocal side for Parkinson's disease, and then LSVT BIG, both PTs and OTs can get trained for a specific kind of curriculum, and it's like a 4 time a week, 16 visit kind of intensive program for people with Parkinson's to kind of get them moving and get them a little bit more functional connections with how like specific movements and big amplitude can get them going a little bit.
Fantastic. I love that. Okay, sorry. The fact that they were all like BIG within that caption.
Sure.
Yeah. Big, or is it another way?
It is big. Big.
I love that. I've seen that those more intensive kinds of programs make a really big difference for neurological conditions. So that's awesome. I love that exists. I didn't even know. So let's jump in. Let's hear a little bit more about your path to occupational therapy. What got you interested in it? And then how did you end up kind of focusing in on helping people with concussions?
Yeah, so it's kind of funny because I didn't know what OT was until I kind of had to decide on a career shift for myself. So for undergrad, I actually went to school for mechanical engineering for, for about 2 years. And then I was like, you know what, it's not a good fit. I don't really know what direction that's leading me in. So I kind of wanted to explore other options. My mom's own second career was in healthcare. She became a nurse, and she was the one who actually brought up OT as an option because she's worked with some in her facility. So from there on, I was deciding to let's do some shadowing during my last 2 years of college, primarily at the Children's Hospital nearby. And I thought, wow, they're having so much fun and they're working to help these kids get better and improve their lives, but it's like play. But there was also this through line of like problem solving, science, creativity that really spoke to me, because that's kind of why I chose engineering to begin with. But there was also this missing piece of connection and a human social kind of element to it that really drew me in. So I thought, why not OT? Why not choose it and explore it?
Yeah.
And then after college, I did a little stint as a rehab aide in a skilled nursing facility just to kind of, get more information and really see if this is what I wanted to do. And it kind of evolved from there. So like once I was in OT school, I went in thinking I wanted to work with kids. Then it shifted to I wanted to specialize in hands and orthopedics actually. And it really wasn't until I started working full time where I am now that I realized I loved working with the neurological population as much as I do. And then that kind of brings it into like the concussion piece, where about a year into me working, we just started getting more patients, and they were coming in primarily with visual complaints, visual issues. And then we're also being referred by some neurooptometrists in the area, asking us to work with the patients and kind of asking us to work with specialized lenses called prisms. And what happened was like, it's kind of like a Hamilton, where like the room where it happened. The one neurooptometrist hosted a bunch of us OTs in his clinic and kind of did a whole workshop with us and taught us like exactly what, could happen after a concussion, like with vision, and what the goals would be to relate it to function. And from there, I was just like, this is so cool. This is fascinating. And it kind of became a little bit of a hyperfixation for me to kind of learn more about it. And I think I was the only one who was really like, wow, I need to know more beyond what I learned in school. And because of that, the more patients I saw, I think my clinic also recognized that interest in my own interest in kind of this population and like learning about it. So they just became kind of more and more on my caseload, and it hasn't stopped me just like researching and trying to learn more about it since then.
Oh, I love that so much. Okay, I love yes. So I think it's actually really cool that you started out in mechanical engineering. It's just such a like testament to how broad OT is. Like it is
Yes.
so like you can use, I'm sure you're using some of the things that you learned from that training in your occupational therapy, because you do need to be able to like understand how things work together, and it just engineering fits with OT. It's so cool.
Yeah, exactly.
Yeah, I love it. And but OT does add that personal component that is so important. At least for people who love OT. Mechanical
Mhm.
engineers, it's great that they love that. I'm so grateful for mechanical engineers. But yes, I think that's awesome. And I love your journey of like I can relate to the just kind of being interested. I went into OT school also wanting to do pediatrics, and then I was interested in hands. I didn't get super into that, but then I like, yeah. Anyway, it's funny how things kind of morph and you end up loving and getting kind of led into
Yeah,
what.
things fall into place, I think, whether or not you expect it to. And I wouldn't change anything, quite honestly. Yeah.
Yeah, awesome. Me too. I feel the same about my experience with it. I think that's awesome. I'm curious. So you mentioned that you guys started seeing more and more patients who had concussions. Were they being referred by the neurooptometrist to, because you're an outpatient facility, is that right?
Yes, outpatient hospital. Yeah, we were getting some people who were specifically referred by some sort of vision specialist, either an ophthalmologist or optometrist. And then also on our rehab medicine side of things, I think people from were kind of looking for help, and then they found kind of our brain injury medicine providers, and who have been starting to recommend this too. So we have a pretty strong just general brain injury program, including like physiatrists, neurologists. And so I think it's hard to say exactly why we started getting more all of a sudden, but it seemed like maybe there's just been more education or more awareness around that time frame for people to start asking more questions
Well, I'm
potentially.
so glad to hear that that's happening, because I talked to so many people who are like just didn't get referred to the people that could help them. Like that.
Mhm.
So the fact that other providers are recognizing that OT, PT can be helpful with this, I just am glad to hear that. That's encouraging. And I assume they're seeing PT as well in this. Like, do they see you and PT and
Yes, we also have speech therapy here too. So, one thing I'm really grateful for where I do work is I've learned so much like interdisciplinary. Like, so it's really is a team approach when we work with these people,
so good.
and because it's not isolated. Like, we can't treat in silos because concussion is so complex and interconnected that,
Amen.
yeah. So, symptom management strategies that I find out or kind of learn with my patients here, I will have PT carried over. And, it's just a very fluid type of treatment as much as we can, quite honestly. So,
Oh, I love that so much. That makes my heart so happy. Like that there are places out there because yes, this is great. Do you guys, I'm curious, how often do you get to see your patients?
So our general kind of frequency is 2 times a week, and they are 30-minute visits for the most part. So it's a lot to condense sometimes in that half hour. If
Uh,
there is room, we can sometimes get people in for an hour if our schedule kind of allows for it. It is kind of a little bit of a barrier sometimes because there's just so much to work on, but we try to make the best of it for right now.
so as OT, you get to see them twice. Does PT and speech also
Also
see?
twice, yes. Like twice a week, yes. Yeah.
Okay. That's cool and really cool. I'm interested in hearing. So there are sometimes people who go to a neuro-optometrist first and then get referred to you guys.
Yes,
That kind of
and but
surprises me. Usually people don't even know about neuro-optometry.
correct. And I think out of the maybe the first few that we were getting in the very beginning, it is often nowadays that people will come in for an evaluation with OT, and we're saying, "Oh, no, you do need to see someone like a specialist to further investigate some things too." So we are much more knowledgeable in referring out now too, and there are we have a list of providers, kind of general area that we can say, hey, these people, they have worked with people who have had concussions or other brain injuries or other neurological conditions, and they would be better suited for you than just your general eye doctor,
Yeah.
usually.
Great, great. Oh, I love it. This is, yes, warming my heart. I'm so glad to hear that this exists out there. So before you started working with people with concussion or like having more of this experience, well, I guess after you started working with them, what surprised you about people with concussion specifically? What was different between that population versus the other neurological conditions that you were treating?
Yeah. So something that really surprised me was the level of kind of almost like medical trauma and misinformation that people with concussions have gone through. I work with a big stroke survivor population, people with spinal cord, orthopedic injuries, and these conditions are way more outwardly obvious, right? In their kind of physical disability, the social, personal changes that a person might go through. And there are providers that are up to date on treatment and are aware that therapy can make a difference.
Mhm.
The majority of my patients who have concussions are coming to therapy 3, 5, 10 years since their injury, and they are still experiencing symptoms, right? They have not been guided or educated in the right way. They have very similar stories of not knowing therapy could help, being
That's
told that they didn't need therapy because their symptoms were mild, quote unquote.
yeah.
They were forced to return back to work or school too early because insurance or medical providers were saying there was nothing wrong with them. And I've met people being labeled as having somatic disorders or it's all psychological in nature. And so it's it's very debilitating for a person to experience that where you're looking for answers and no one's giving it to you. So you're like, what do I do? And sometimes, on the other hand, if they have had therapy, it's not comprehensive. I've had patients who were told to just do VORs, turning your head back and forth over and over again with ignoring other signs or other deficits. And then at the best, that's unhelpful. At worst, like that can actually make you feel worse if your system's not ready for it. And so um, I find a lot of these people feel like their only option is to push through and kind of act normal now because that's the only way they can kind of get through their day or prevent things from getting worse, maybe. And unfortunately, that kind of sometimes creates a cycle of like rigidity and hopelessness that I've noticed with people who have had very chronic symptoms, and that becomes a barrier in itself. So it's really important, I think, for me as well as like other clinicians to kind of acknowledge and validate like those feelings of maybe they've internalized embarrassment or shame about how they do things, and then people thinking that they're okay. Like, why shouldn't they be able to do these things? So it's just kind of like you're learning more about the people as a person versus as like a patient. So that's been kind of big for me.
Okay, I'm like dying over here, like, yes, amen to everything you are saying. Like, can we get a amen here? Like, this is seriously like I so appreciate you just like worded that so beautifully. Everybody needs to listen to this and replay that section that you just did. Like I that is 100% what I have seen as well. And it is absolutely like it's heartbreaking, but also so in heart and heart. Is that a word? Like hope giving that there are people out there who are seeing this, we're recognizing it, we are trying to get the word out. I love this. And I'm curious for with your experience, like people, you guys started getting more concussion patients and then you started learning more about it, right? Like how much of this did you know prior to working with this population?
Nothing.
Okay. And
Nothing.
you
This is
just
all.
looked it up and figured it out on like as
Yeah, it's purely been because, people have been coming to me and you're like, I see a need. I need
yes.
answers. And who else is going to give them to me if they haven't found them? Like I have to find them too for myself. So a lot of it has been a lot of self-growth as well and through experience with people. So
Ah, bless you. Bless you for blessing your people. I love it so much. That's so, so good. And there are a few things that you said that I just want to like bring out or ask you more about. One, I love that you mentioned the just how important it is to have that interdisciplinary approach to it. Like recognizing that we have things to offer, other people have things to offer. We're all going to learn from each other, and
mhm.
that the patients need more than just yeah, do a VOR. Like you need other perspectives. There's so many aspects to concussion, and you need somebody who understands all of it to
Mhm.
and can work with people in multiple ways. So I appreciate that. I really appreciate that you brought up that that experience that so many people have of dealing with this chronically, being told that they're crazy or lazy or
Mhm.
questioning it themselves. Am I crazy? Am I lazy? What is happening? Like I look like people anyway, you said it also beautifully, but that rigidity and the hopelessness, I think that's the point of one of the main points of my podcast here is to try to bring hope to people who are exactly feeling that way, who've like feeling that hopelessness because it's been so long and they haven't gotten answers. So um, that is something, and maybe I usually like we could talk about it later, but I kind of let's just since we're here,
Sure.
how do you offer that hope? I love that you mentioned validating, being like, yeah, this has been really hard for you. Like you recognize where they're at and why they're there. Um, is there something that you do to like try to instill that hope or help? How do you deal with hope?
How do you deal with them? That's a big question.
It is.
Um, it's hard sometimes because again, some people are very convinced of there's certain ways of doing things, right? And so hope is often tied to whether like what that meaning is for like returning back to something or to living life. So some people think it's I have to have no symptoms whatsoever. I have to be perfectly normal. I have to be exactly who I was before. And that is my benchmark for success.
Mm.
Hope is hard for those people, right? Because they'll see fluctuations in symptoms, they'll kind of have new stressors. Even as they're getting better, you're doing more. And that's going to be even more of a challenge because your body is adapting to it.
Mm.
I try to set the expectation that, yes, like there is hope that you will recover. But also, like, what does that recovery look like, right? So the idea of resilience is kind of the idea is like, can you be adaptable? Can you be flexible in the face of challenges? Can you see a world or a life where like you're leaning into your values? Like what is truly like meaningful to you? Like, is it your job that you hate, but you have to do it? And it's like 9 to 5, but like, that's my benchmark of being successful or being who I was. Or is it something where like maybe it doesn't have to be that exact same profession, but maybe you're still meeting the needs of providing for your family, maybe meeting needs of giving back to the community. Um, so I try to have that open conversation with them and kind of plant the seeds a little bit of what your end kind of goal and what that hope will look like may not be maybe your first impression of it. It can keep changing and it's okay for it to keep changing. But also at the same time, knowing I always set the tone of like, as much as I am an expert, quote unquote, like in this area, and like you're coming to me for help, you also know your body, you know your life, you know what's valuable to you. So I'm here for you. And that's not just you're a part of this like journey with me as well. So I think kind of building that rapport too, just to have someone in your corner builds upon that kind of like, oh, okay, I don't have to do this alone anymore.
Yeah, I love that so much. It's really, really beautiful. And I do think that reframing or like understanding resilience and, people, you will never not have had this injury. Like if you break your leg will heal, but there's evidence that happened. And it's going to be the same thing. Like you can make really good progress. There may be things that linger, but you're going to know how to handle that. And, like you said, you may find really amazing things on the other side of this that you couldn't have anticipated, which I do hear all the time. And sometimes people are not in a place to hear that. Like they don't want to know that right then. And that's okay. It's totally okay to be wherever you're at with that. But I do really appreciate that perspective. I also wanted to ask, you said you're sometimes seeing people 3 to 10 years post injury, which yes, and you can make a difference for them, right? Like,
yeah, absolutely.
Okay, good. I want people to know you can, there's recovery and healing that's possible even that far after. But I'm curious, how are they finding, like, they're getting referred to you, are they getting referred to you for that injury, or are there other things? Because usually within the healthcare system, if it's an old injury like that, somebody can't just be like, oh, here, go to therapy for this now, or can you?
Sure.
How are they
so I'll
getting
give an example. The one who sticks out of my, so she had a concussion about 10 years ago, and she was lucky to find a kind of more intensive program at the time. And it got her to a certain point where, a lot of her symptoms improved, and they were, recommending like continue with these exercises, and go forth. And she was feeling on the up and up. What happens, however, is along the way, like lifestyle stressors kind of fell into place. She became much more involved with caretaking for her mother. There were kind of changes in relationships, a lot more changes in her day to day, where, like we know with concussions, like that autonomic kind of component, that psychosocial kind of component of how your body feeds into stress. Can affect also like how you feel. So maybe those kind of lingering symptoms that were kind of also improving, because she was maybe unprepared for those changes, sure, they spiked up again a little bit more. And so she was also someone who is a very go, go, go type of person, exercises so much, lives a very active lifestyle. So sometimes I see with individuals like that, how much time do you take to yourself to slow down? How much time do you stop being the giver for everybody? And so eventually your body wears down on that. And so the symptoms that were kind of still lingering may be transformed or kind of lit again, kind of under it. So for her, she was seeking help, and she was looking and doing her own research. So she was the one who was still actively looking for help, because I think it got too overwhelming for her at that point. And then when she was finally connected with our facility through research, I guess just online, we worked a lot on that lifestyle component of how do we start taking time back? How do we recover? Mindfulness was a really big thing for her, just to kind of carve time for her to settle and not let all those kind of inconveniences of the day overwhelm her. And she did so much better, and she learned better strategies kind of for like the life ongoing kind of thing.
Oh, that's so awesome. And she was able to, I guess, was she able to get, like, was she using insurance and able to
She
get,
did use insurance. Yes, she did use her insurance.
and was it because she had new symptoms that were related to this that had come up? I just, in my mind, the system is so broken. And
Sure.
people, like, if they're 10 years out and they're like, they hear this and like, okay, I can actually there's still hope for me to get better. Like, how can I access help for this? Like, within the system, is that possible? Can they go and get, do they need a referral from a doctor? Like, how would people?
Yeah, so she first met with one of our physiatrists here, who does specialize in concussion care. And so I think finding a provider who is knowledgeable and can kind of say, hey, maybe the treatment you had in the past was not appropriate or was not enough, or you are still having these big functional changes or deficits, they can justify it. I haven't had any issues. More so workers' comp is a little bit trickier. If something's after a job, that's a little bit more challenging. But if it's just your regular insurance, we haven't had a problem.
Awesome. Okay, that's good to know. Thank you for putting that out there. I appreciate it. So you mentioned that rest piece, like the finding time for yourself, the mindfulness. Love it. Thank you for bringing that up. Definitely something that's key and very valuable as especially like I think as OTs, that's something that we can bring out for people. And kind of along those same lines, you talked about or you mentioned that you've done the Love Your Brain yoga. So I've heard about it. I'm familiar with it, but not deeply familiar with it. So I'm excited to talk to somebody who knows it well. So tell me, how did you get involved with that, and what has been your experience with it?
So like you said, like OTs were kind of very aware of other like holistic approaches, kind of alternative type of things. So in my own practice, even beyond concussion, I've incorporated things like meditation, mindfulness, yoga, just to kind of have that gentle habituation of movement and for autonomic regulation. But I really kind of wanted to have a more formal training to see if there as an extra tool for myself. So our facility had actually become a clinical affiliate with LoveYourBrain after some good legwork with our brain injury department, and started hosting free groups in the afternoon. So they're 6 weeks long. And so individuals who have had strokes, brain injury, they come, and there's opportunities for community and kind of discussion and no judgment in those rooms. And for their very first session, I actually had recommended one of my patients, my concussion patients, to go. And I went with him. And I participated in support just to say, like, hey, like, I'm with you here. And since then, I really wanted to do the training because I was like, I want to be able to do this on my own, or like kind of in conjunction, or have the tools like more readily available for myself. And then, so with the course, you really learn a lot about the research that supports yoga practice with people with a brain injury, and how it can help with, again, the resiliency piece, the mindset shifting. They talk about pillars of, including like realistic optimism. Like, you don't have to only focus on the positive, because that's not necessarily realistic, but you also don't ignore the negative. Acknowledging that, if you want something or you have a goal to be achieved, it may require effort or work to achieve it. So there's that balance of saying, okay, I want to feel as good as I can. I'm going to be real positive about it, but it's going to take work to get there, and that's okay. And then they also focus on that cognitive and emotional flexibility too. So they focus a lot on adaptations for yoga poses, and to make them more tolerable for people with brain injury. And also they take into account issues with balance, dizziness, visual strain. So it was really pretty comprehensive to see something targeted and meant for people in this population. And I recommend people to do their online mindset groups. They're free. You sign up online, and they just recently started a concussion-specific group called Life After Concussion. And I've been referring whoever will listen to kind of join it, because I've seen positive changes after it. And it helps a little bit on that psychosocial piece that can sometimes overwhelm sessions, I think, especially since we have such short timeframes in my practice. You can't address everything. So to have someone else reinforcing, like, hey, maybe this is a better way of reframing things and thinking things so that you can allow the other interventions to help you. This is a really good option as well for people.
Beautiful. I love it. Thank you. And we'll link that in the show notes. So Life After Concussion through yoga, Love Your Brain yoga.
Yes.
And it's more of like a support group, like you join on Zoom and it's talking. Is that the?
Correct. Yeah. So there's a couple versions. I think there's one specifically with yoga movements involved, and then there's one that's more group discussion without the physical activity, potentially.
Okay. Thank you. And I appreciate that you bring up that psychosocial piece. That's why I do the coaching that I do, because it is, It's key. I really feel so strongly about this. It is key to recovery and healing. Like it will affect the way that you think about things and frame things, your mindset, that will impact your physical recovery as well. Both are very important. You need both. And so I love that, I know you started your Instagram page to specifically work on, like, give people help with that psychosocial piece since you don't have time in your job. They don't let you, you don't have enough time to address that, but it is so important. So I can see that you feel the same about this, like how important it is.
Yes,
And
yes.
I love that, and that you're finding other resources to help your patients access that. Do you want to do you want to say anything else about the psychosocial piece, like how important it is, and what do we mean
It's
by it? What do we mean when we say
what do
psychosocial?
we mean by psychosocial? So psychosocial is, how do you think of um, yourself and how it interacts, like your mindset, the way you internalize stress, the way you internalize joy, like how does that manifest in terms of your interactions with people, how you live your life. A lot of people, like I said, with concussion have gone through that medical trauma, so psychosocially they have this concern of not being believed. They have people kind of passing judgment, even though there's a mismatch between how people see you and how they feel. So um, I think it is often the missing piece for a lot of treatment, because, people are sold on magic kind of cures where just do the exercises and then everything will fall into place. As OTs, we know that's not true. If
Look
you
forward to
don't
it.
if you don't connect what happens in your session to what happens outside of here and actually go through the steps, go through the adaptations, or just the variation that can happen once you leave here, people are going to think, oh my gosh, I'm falling backwards. I'm getting worse. But because it's just because they just don't have those tools or that realization that situation to situation, it depends. And it just means that you just have to have a different tool or strategy for each of those situations. It doesn't mean you're failing. It means it's just there's a little bit more workshopping to be done. But you also can't approach those situations as failures all the time because you will start to believe that's the only thing that's happening too. And I think that's the big piece too.
Yeah, thank you. I really appreciate that perspective is so important. And so yes, if you're listening to this, know that the way that you're thinking and how you're there's so much to this injury. It is so complex, and so like there's so for anybody, there's so many pieces of us and things that influence how we respond to things. And so yes, doing the things in therapy are very important. There's a lot more to it. So be open to that, and yes, find the help on that more psychosocial piece, the
Yeah.
side where
Be
you're.
open to it. Yeah. Be open to treating yourself as a full person, not just someone who has XYZ symptoms, because that will only get you so far, I think.
Yes, perfectly said. Thank you. Yes. Um, I Speaking of whole person and more than one parts, let's talk a little bit about the vision piece. I love that
Sure.
you're getting that training in that. I love that the neuro-optometrist was so inspiring to you as you learned more and were like, oh, let me learn more. I actually have an interview that I did with a neuro-optometrist a while ago that I can link on here, and then there should be another one coming out in a little bit that actually by the time this comes out, it will have just barely posted. I think I did it like I interviewed him last week for more about it. It's just there's so much to learn and so many fascinating things within the vision world.
Mhm.
So I'd love to hear um, what made you want to do it and what benefits you're seeing for your patients with as you're learning these things.
Sure. So it's interesting because in school I learned about visual perceptual, the general basics of ocular motor control. Um, Low vision is kind of big in the OT realm. For this population, a lot of what I learned is just how we have differences in our visual systems for taking on what we see in front of us, but also like how do we interact and handle our environment. And so one of the biggest pieces I learned is that often um, we get so used to creating demand on one system and it gets overworked for the visual system. And that's why things like VORs, if your body isn't ready, can actually make things worse because you're just relying on one system of your vision versus that kind of spatial component for understanding. And so people with issues with tolerating like busy places like the grocery store or being in a car and having things pass by them, that can be very triggering for them because there's that mismatch or imbalance. So for the certification, it's actually an online certification with like about 30 plus hours of learning. It was more of an option for me to just really streamline what I think I knew and then also what it actually is so that I could just be more comprehensive and direct with my care. It covers information about general anatomy, assessment, treatment, and also the use of like optical interventions like the prisms and just general know-how about different lenses or prescriptions that people can get, and also specifically treatment procedures for people with brain injury, concussion, other neurological conditions. Like I said before, like a lot of the information I've gotten before is just a lot of self-led research, a lot of experience, a lot of kind of reaching out to my PT counterparts, reaching out to the neurooptometrist and saying, what do we think about this situation? So I'm really hoping that my patients can benefit from that understanding, but also me maybe reframing things and kind of teaching them to have a little bit more agency and understanding of what their symptoms are so that one, they can communicate them better to or understand them for themselves, but then communicate it to some other providers as well to again then have that trickle down effect of this is what's happening. This is what happened to me after the concussion. And so I can also be informed with providers myself and kind of connect the dots there.
Oh, that's so great. I love that you're doing that for your patients and that knowledge for yourself and that you're able to educate your patients so that they know what's going on with them better. That is really huge. I are you able, I'm guessing not, but are you able to suggest that people get prisms, or I assume that's all on the optometrist side, right?
It's usually on the optometrist side. We may have like inklings like, hey, this is kind of speaking to us in a certain way. We're kind of suspicious or have seen success with people who have gotten prescriptions for certain things or have recommended training with the prism. So, but we will refer out and make sure that they actually see someone who can confirm or like dictate that type of care for sure.
Cool. Very cool. And we've mentioned a few times in here and kind of talked about what it is, but just so people who are listening, if they're curious about what VORs are, it's that the vestibular ocular reflex, and there's like specific exercises that people do where you like keep your eyes in one place and move your head around and things like that.
Yeah, so a lot of gaze fixation. Yeah. So if you think about, reading and kind of keeping your eyes on a book for so long, your eyes will fatigue after a while. So something like that, if the eyes haven't had time to rest or they haven't rebalanced themselves, your eyes will get more and more fatigued and just kind of, you'll feel it in a certain way.
Yes. So it is astounding to me how impactful the visual system, like how much energy of the brain it uses, how much of the brain it takes up. The visual system is intense and there's a lot to it and so much to understand and learn about it. So, but it is often one of the key pieces for people who are dealing with concussion, and a lot of times people don't even realize that their eyes are not working together well.
Correct. Yeah.
Like, no, I have 20/20 vision, I'm good. But no.
That's all they think. It's like, I can see clearly, I got my glasses, they're pretty good. And then they don't realize it's
they don't even realize. There's so much more to it. So here's another plug for people listening. Get your eyes checked by a neurooptometrist. Okay, excellent. Thank you. So I would love for you to share some of the things that you have found to be most helpful. I mean, every individual is different. We understand that. But are there any like kind of generalized tips and tricks or things that you found to be helpful for many of your patients that we can throw out here for people listening to know, like, oh, okay, this is something that I could try if I'm struggling with different things? I know that's a really
Sure.
question, but any things that you have found that are really helpful for people?
So a couple of things come to mind, and this is actually, I'm thinking of another patient who gave me this feedback after we finished up. There's a lot of power in pre-planning a worry or symptom mindset and recognizing that emotional curve of the journey. So it's okay for your symptoms to fluctuate or for things to go sideways, and it's a little expected as you're trialing different things. But as soon as you discover or you work with your therapist to learn about a tool that kind of helps bring symptoms down, or a strategy to kind of keep them from escalating, use those tools. Be very proactive with them. Don't just say, okay, you know what, it only bothered me today, it won't bother me tomorrow. That's not the case. You have to start teaching your body and your brain to get out of that fight or flight mode and kind of to be able to handle, again, challenge in an appropriate way. So listen to your body, don't ignore it. If it's yelling at you, if it's whispering at you, it's a sign that something needs to be modified. And again, like kind of having tools ready and knowing when to use them, it will be very helpful, as well as keeping track of those symptoms. Like sometimes people don't realize that things build up just from doing those smaller activities. That could be doing your normal morning routine, brushing your teeth, uh, making breakfast, and they don't equate that to their symptoms building up before then they do that big ticket item where they go grocery shopping, they go to a concert, but they all kind of interplay together. So ask yourself, are you having a balance of activities? Are you having time to recover or rest, or at least mix and match something that's weighs a little heavier on your body or your mind with things that bring you joy, things that bring you um, that recovery piece in different ways. So that needs to be kind of balanced as well.
Yes, thank you. It is so important to be to intentionally kind of strategize ahead of time. Okay, I know this thing is going to take a lot out of me. Can I rest ahead of time and afterwards, like plan it that way, which again, we all know that the executive functioning, the planning is hard to do. So like
Yeah.
it's helpful to maybe if you have somebody that you can talk to that can help you with those things, that's beneficial as well. But yeah, that is a really important tool. And I think as you're talking about knowing the tools that work for you. Like sometimes I've talked to people who are like, I don't remember them. I don't know to use them when I'm in it. So maybe write it down, put it somewhere where you'll see it, and like make it a regular habit of practicing those things when you don't need it, so that when you do need it, it comes more naturally, it comes more automatically.
100% agree. Yeah.
Yeah. What are some of the things that you found to be helpful for people in getting out of that fight or flight? Or do you have any things some of your favorites to help people calm down?
Yeah, breathing works for some people. I think it's kind of a mixed bag where we've done guided breathing. Sometimes it helps to do a lot more externally focused breathing. So um, I just was at a course with Julie Hirschberg and Reactive, and we did a lot of bubble play, like blowing bubbles, like for that external focus for your breath. I do that a lot with my patients actually recently. I found different sensory inputs like very light vibration or weighted blankets, kind of weighted shoulder wraps, weighted anything can be helpful to give that grounding piece too. So if things feel, or if people feel more imbalanced or ungrounded, those pieces usually help to bring more awareness to their body in a safe way. And then it's just kind of exploring them, and maybe it's just a different positional change or an environmental switch, right? Like how can we turn the volume down on certain environmental triggers like light or sound in the moment, to allow you to come back down and then be ready for the next thing.
Excellent. Thank you. Yeah, I think as OTs, especially the sensory piece is something that we should know well and utilize well. And it is really key. With that, just since it's such a treat to get to talk to another OT who's so passionate about this. What do you see as the biggest contribution that we as OTs can make in this field, and how do you think that we can that OTs can improve their participation in treatment in this population? Because not everybody has dived into this as much as you have and like gone out and learned so that they can provide that kind of treatment for their patients who have concussions. And not everybody has as many concussions. Like it's understandable, but I feel like there needs to be change there. Like in general, like we need more education or trainings, or it's such a unique issue that people are dealing with that it's not the same as other things. And so anyway, how do you think we can best serve patients, and what is our role here?
that's a huge, I have a long answer for that. But basically, I do think OTs have so many strengths to bring to the table when working with the concussion population. We are experts at bridging those gaps and connecting the dots of like life and function, right? So we understand that it's not a one size fits all solution. And it's really a matter of like who you are, what you value, what you want to do, how you want to do it. And I think we're very strong at doing like a holistic approach of tying that in with your goals or deficits of including like those physical, mental, or cognitive deficits that someone's going to experience after a concussion. So I think that we would be very helpful in helping people with, again, tailoring those strategies to fit within the unique demands of their lives, and so that they can carry it over outside of that bubble of therapy. So whether it's at home, at work, in the community, we can work with you. So people who are like, I don't remember my strategies or I don't think to use them, OT can be there to workshop it with you and say like, okay, how do we then figure it out so that you can be successful with that? How do we support you in this situation, that situation? And then teach you too, like how should you plan? How should you kind of use those tools for pacing? And have you practice them so that you can actually feel the effects with it, because it's one thing to say and to tell someone to do it, but that's another demand that someone just can't always handle after with all these symptoms. So we can really tie it into function and have you do it and experience it so that it sticks a little bit longer. Generally, I think OTs can also just lean into their therapeutic use of self, and that's a very OT term, but basically it means, building that rapport, using your empathy to have that partnership mindset with your patient so that, you're knowledgeable in specific techniques or approaches, but your client or your patient will also have benefit from that validation and partnership mindset so that you're working together and they're feeling empowered versus just someone telling them a new thing to try to add on to everything else that they're experiencing. So, and additionally, again, back to that interdisciplinary side of things, as much as we're very strong in that kind of sensory, lifestyle, psychosocial vision, a lot of what I've learned is from also my other clinicians, right? So physical therapy, speech therapy, the neurooptometrist. If you don't know enough in those areas, I encourage you to learn more, because that way you can help your patient recognize what's happening with them, because they will experience vestibular symptoms in your session. How do they carry those things that you're teaching them into that as well? And how can you refer them to the right providers as well so that they have a very comprehensive amount of care?
Yes. So well said. What can you share some of the things that you have learned? Like if somebody's listening to this and they're like, okay, do I go to an OT? Do I go to a PT? I obviously, ideally, they would get to see everybody's speech. Like I think all of the ones that you mentioned have key important things to add. In general, and again, this is obviously general, there's a lot of overlap between all of us, which is something that I love, and people they need the reinforcement from different providers and working on the similar things. But from what have you seen people from on the PT side? What have you learned from them? And on the speech side, we've kind of already talked about the neurooptometry stuff, but
Sure. So for PT, it could be something as simple as just recognizing when someone might be having BPPV, like a peripheral vestibular disorder that needs to be addressed first before the other interventions that you're trying to do can really be effective, right? And then also recognizing other contributions to dizziness, headache, neck pain. I've learned a lot about cervical proprioception, about how that can be such a big trigger for your headaches and your dizziness, where you may be confusing it or having it match up with visual issues at the same time. So how do you tease that out to really ensure that your treatments are actually targeting what they should be targeting and you're not kind of missing any of those puzzle pieces? With speech, a lot of times we tag team on that cognitive side of things, memory issues, focus issues, but also that pacing type of strategy of, hey, like how do we plan and use or have strategies for when we are more cognitively overloaded? That's very helpful for speech to take on, especially if OT is doing a lot more of that lifestyle psychosocial piece. So it's kind of an ebb and flow. But I think, again, it's just recognizing who can kind of offload it so that you can focus more on certain areas without burning yourself out too in a certain way.
Yeah, beautifully said. And yes, it is such a team approach is the way to do it. Like there's so many aspects to this and having different eyes, like it is really helpful. I'm curious about a little bit more, if you wouldn't mind saying a little bit more about the cervical proprioception. How does that get confused with vision stuff? Can you say more to that?
Oh, sure. So sometimes I will see people with very obvious like ocular motor deficits, and maybe you're getting only a certain way with improving that. But we are also recognizing that maybe someone has decreased proprioception or strength or stability at their neck, right? So if you have your eyes trying to move in all different directions, but you don't have a stable base of support for them, or you don't have a good awareness of your alignment of where you are in space from your neck down, it's all going to interfere with each other. And so if you're kind of saying, oh, why is this patient only doing really well when their head is supported and they feel no symptoms, but as soon as they stand up or they're upright and there's no support, things kind of come online a little bit. It's important to recognize like what else is the missing piece to that. And so collaborating with your PT on specifically working on that, but also carrying over their techniques of how do I position the patient? How do I carry it over now into the visual activities that I'm doing so that it's not just waiting for one to resolve to do the next. You're kind of working on every piece at the same time.
Yes, awesome. Thank you. That just goes, it's more evidence of how complex this is. There's so many things that can be playing into it. So yeah, thank you for that. I okay, so I know we're getting close on time here, and I so appreciate everything that you've shared. This has been so helpful. And just reinforces to me how vital the OT contribution can be with for this population. When people are struggling or feeling like they have a setback, what what do you say to them who when they're in that moment and they're like, dang it, I woke up with so many symptoms today. I don't even know what I did. I didn't do anything yet different today or yesterday, and here I am. Like it feels so discouraging. What do you say to them?
Yeah, so I've leaned a lot more recently into kind of putting it back on the person, saying, I hear you. I hear that your frustration, and it does feel frustrating that it does feel like a setback or something. And I will reinforce that it's okay, or try to delve into maybe what the difference was in situation so that they can acknowledge that it will depend situation to situation. But then I will also ask them, like, what is something then that we can do to um, offload that feeling of frustration? Like, what do you want to work on? What would be one step closer to making you feel more competent or more confident in that area? And then we try to be very specific with how we address it in session, and that it's a very open-ended answer, but I will try to have them lead in terms of what their um, kind of focus is, and see like if that would they want to work on just relieving the pain, or is it can we workshop a strategy so that it doesn't happen again the next time. But again, giving them that autonomy to choose and kind of decide, I think goes a long way as well for people who haven't had that kind of confirmation or choice in the past for how they've gone through treatment.
Yeah, I think that's so important that I love that the validation, like, yeah, this sucks. This is real. What you're
Yeah.
dealing with, like you're valid in feeling this way and not trying to like change their mind for them, that letting them kind of lead it and also giving them an opportunity to channel that into something that might feel more productive. But sometimes
Mhm.
letting them just sit in a bad day, like it's okay to,
Sometimes it is just sitting with your feelings, and then let's say like, okay, let's try this to try to address it like through my guidance. But sometimes they just need that moment to really experience it and process.
yes. Yes, thank you. And what advice do you have for people who are, well, if you have any, I know this again, such a general question, so you go with this however you want. You can even just like skip the question. But if somebody has had a a concussion, or they're listening to this and are like, I'm still dealing with this and it's been a long time, or it's new or whatever, like what advice do you have for someone who's dealing with it themselves? And then do you have advice for loved ones and caregivers?
I would say we only have one brain, one body, and they're already doing so much for us to keep us safe, healthy, to interact with the people that we care for, right? It's important, I think, for people post concussion to advocate for their needs instead of just kind of pretending everything's okay or thinking that they have to take on that burden, right? So if you do need a break, if you do need support from a family member, from your spouse, like ask for it. Don't be afraid to ask for it because then also there's a lot less miscommunication of kind of, again, that feeling of why is this person not doing what their roles are meant to do or how they were acting before. But again, it's because maybe it's just not very outwardly obvious to someone else. So I would say do not be afraid to express what you are going through because that will only help other people understand. And then for the caregiver, that takes off the burden of them of having to be like, why am I doing so much potentially? But also like, how can I better support you then so that we can all meet in the middle a little bit? So that understanding and that being the very vocal about your needs, I think is a big piece of advice for people.
I think that's hopefully good for people to hear. I think that it can be hard, it's vulnerable, and people don't often talk about it when they're struggling. And so like acknowledging it and saying, yeah, this is actually hard for me and I'm struggling with this, and then asking for help. Something I would add to that too, I actually just was talking to a client earlier this week, and he was struggling with this a little bit, this like feeling, and but it's underlying. You don't a lot of times this like I'm not able to show up as the spouse that I want to be. I'm not being the parent that I want to be. I can't do the roles that are really meaningful to me. Like that cuts at the core, and a lot
Yeah.
of times like that's underlying, it's simmering down there. It's not even fully consciously recognized, but it can bubble up into like being more impatient with things, or like you're frustrated with yourself for not being able to do stuff. And then you take it out on the people that you love who are trying to help. And it's just like, it's so hard. It can be so, so hard. And so like, I just want people to know if you're there, like you're not alone and it's totally understandable. This is a thing that happens. Um, and so journaling about it and like placing some conscious attention and shining some light on what it is that is really at the core of what you're struggling with right now, and what you're making it mean about who you are as a person or whatever. Like having that
Mhm.
conversation with yourself and writing it out and just like recognizing it can be really, really helpful. Like we have these like deep fears of like, oh, I'm not going to be the person I want to be. I'm not going to be able to show up as I want to, and that it's real. And again, I kind of feel if it's like shining a light under the bed, like these are the monsters that are under there that are creeping over there that you're not even fully aware of, but you're scared of. And so shining a light on it, talking about it, thinking about it, and expressing it, at least to a journal, getting it out of you can be really helpful and important, and then give you some, basis to stand on for when you're having the conversation with your loved ones and saying, this is what I'm really afraid of. This is why I'm responding the way I am. Like, I love you. I'm so sorry. This is really hard. And just like having the conversation, asking for the help. I think both of it's all important. It can be
Yeah,
helpful
absolutely.
to address that underlying piece there. Um, this is, yes, been such a great conversation. Thank you so much. Is there anything else that we haven't touched on? I mean, we touched on a lot, but anything else that you want to make sure that gets said in regards to concussion treatment?
Yeah, I think just along those last trains of thought of what you were saying about there's a lot of those simmering fears or kind of habits or things that just haven't really come up until something like a concussion happens. I often find myself saying to people like, "Hey, this is also for as uncomfortable as unwanted that this kind of situation was. Use it as an opportunity to kind of make your life the way that you want it to be, kind of thing. So like if you were always the giver, if you never prioritized yourself, if you never had time to kind of devote to others because you were so go, 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 or you just kind of drained yourself dry, learn how to kind of, this is your opportunity to learn better ways of handling that. And maybe you'll leave a little bit more, better than when you came in those certain ways. So there's a lot of hope for that as well.
Yes, amen to that. It really does help narrow in on priorities and focus on the things that matter most. And I think that post-traumatic growth they talk about, like that's a thing for sure. There can be really beautiful things that come from it. And I love that gentle way of bringing that out. I love how you say that to your patients. So thank you for what you're doing. Thank you for the work that you're doing and the passion that you have for learning more and really providing quality care for your patients. I think it's a beautiful example, and hope we can, it will inspire lots of people to want to do the same thing. So how can people learn more from you or work with you? I don't know obviously I imagine they need to be within your hospital system, but what can people do to get more from you?
Yeah, I think the easiest thing would be to follow me on Instagram if you have one at Impact Concussion, or you could email me at impactconcussionot@gmail.com. And I'd be happy to kind of answer any questions and provide any guidance for people who are looking for it.
Fantastic. Thank you. Thank you. Thank you. I really am, just so grateful for your taking the time to share this. I think a lot of important things have been said today. So I appreciate your being here.
Thank you for having me.
I'm so glad you listened in today. I hope you have gained some helpful insights and inspiration regarding dealing with and recovering from concussions. My goal is to create more awareness and education about concussions and the fact that there is so much that can be done to improve life after someone has had one. Help me spread the message by liking, commenting, rating, and subscribing to this podcast, and share it with others who would benefit from hearing it. There are more resources available on my website. And again, if you or someone you love would benefit from concussion coaching, sign up for a free consultation using the link in the show notes or at my website, www.theconcussioncoach.com. Thank you. See you next time, and take good care of that amazing brain of yours.